All right, have you ever heard of something during pregnancy called carrier screening? Is that something that has come up ever? What do you think, Bodhi? Have you ever heard of that? I have my dog Bodhi here because I want to mention and talk a little bit today about carrier screening. And if you can see, Bodhi has, can you look at the screen there? He has one blue eye on his left eye and one brown eye on his right eye. One blue eye, one brown eye. Can you say hi? So Bodhi has something called heterochromia. Heterochromia is not necessarily always considered a genetic condition. It can be sometimes. It is not the kind of genetic condition we're talking about today with carrier screening. So I don't want to confuse anyone. The reason I bring this up in general is just to give an example of something that could be genetic that you're able to see. And that might have people take more action or be more excited about it or whatever. What we're talking about today is called carrier screening. It deals with autosomal recessive conditions. And the issue, and probably why it's not brought up a lot, is you're screening for rather something that no one is affected by. So you can't see that they have one blue eye. You can't see that they have blue fingernails. You can't see that they're affected by it at all. So a lot of people don't understand why screening is important. So today we're going to talk about that and try to really understand why it's important to get carrier screening done to see if you are a carrier for a type of autosomal recessive disorder, which then will help you understand that you could then have a child or offspring that's affected by that disorder. So hopefully I can help you to understand that a little bit today, and we'll use some examples. I think we're going to use blue fingernails, and maybe that'll help you understand it a little bit. Now, please don't take heterochromia and go looking it up and thinking it's an autosomal recessive disorder. It is not. This is more just for an example of when you see something, people tend to take action or say something about it more. When you don't see it, for example, when you're a carrier for something, you might not know about it and it's not discussed as much. So as I mentioned, carrier screening. You might not know anything about it, so we're going to learn about it today. Welcome to the Dr. Lexi Show, where I take pregnancy topics and break them down into simple terms to help you advocate for yourself and your pregnancy. I'm Dr. Lexi, a board-certified OBGYN and maternal-fetal medicine specialist, which just means a high-risk pregnancy doctor, and today we're talking about carrier screening. So I want to kind of relay to you all a story. So I was at an event a few years back, a while back, I guess, and it was one of those events where they're raising money for certain conditions and people who have gone through a hard time. And this individual case was a couple who had a child born with cystic fibrosis. And they told a very touching story about having a child, taking that child home, and noting that the child had some symptoms that had them come back into the pediatrician office and ultimately having that child tested because there were some breathing issues with the child. Ultimately, in the workup, they had a genetic workup and found out that that child had cystic fibrosis. While sitting in the audience as a maternal-fetal medicine specialist, I was shocked and really sad because they had no idea that either of them were carriers for cystic fibrosis. And when they told their story too, they had never been offered carrier screening and no one had talked to them during their pregnancy or even before becoming pregnant that carrier screening can be done to see if the two of them together have a chance of having a child affected with something called an autosomal recessive disorder, which an example of that is cystic fibrosis. For so many reasons, this is an important topic to me, but that story resonated with me so much the day that I heard it, and I always try to help my patients understand what carrier screening is, and my friends understand it too. So if they're planning on starting a family or they're currently pregnant, that they can get that screening done before they get pregnant or as early as they can in a pregnancy to understand their risks for autosomal recessive disorders. Before we dive deeper into the topic, don't forget you have your free downloads that I will include below for you. The common one about the questions to ask your OB providers can be found at drlexihill.com/advocate. All right, so let's start. We want to get into expanding our knowledge first. All right, so what is carrier screening? So before anyone gets pregnant, let's say I'll just use myself as an example of someone. It makes it easier for storytelling here. Let's say I'm like, I think I'm going to go have some kids sometime soon. I'm going to start a family. I would like to know if I am a carrier for any disorder, that if my partner is a carrier too, that we could end up having a child that would have that disorder. So let's use it kind of like, let's say I'm a carrier, I have a genetic mutation where I'm a carrier for my fingernails turning blue. My fingernails won't turn blue, but I'm a carrier for that. Let's say that the person I'm having a kid with is also a carrier for their fingernails turning blue, but they don't have blue fingernails. Both of us don't have blue fingernails. Why would we think either person has a mutation for it if we can't see the blue fingernails, right? Then we have a child together and the child has blue fingernails. And we're like, oh my gosh. Well, had we been tested, we could have found out if we were carriers for having a child with blue fingernails, meaning we carry the trait. Both of us carry the trait, and then that puts us at an increased chance of having a child that has the actual disorder or disease. So I can carry the trait, partner can carry a trait, doesn't mean we show what the actual disease is, the blue fingernails, right? But since we both carry that, we can then have a child who actually shows, which we call that a phenotype, shows the disorder, so shows blue fingernails. The other thing about carrier screening that is good to know about the definition of it is that we use the term carrier screening. And what we're testing for is to see if an individual is a carrier, meaning they carry that mutation, but they're not expressing it. Okay, so they're a carrier. They are a carrier for an autosomal recessive disorder. And that's kind of what I explained, meaning you could carry something, meaning you're carrying this genetic mutation but not expressing it. And then if two people get together that both carry that same thing, that same mutation, they could have a child that actually expresses it. The reason that's so important is we will get into, that's the question. Why is it so important to know about these autosomal recessive disorders? Well, I want you to see as we're bridging into this, there's something called a Punnett square. So let's give the example of me being the carrier of blue fingernails. So for me to actually, in an autosomal recessive trait, or excuse me, let me say that better, in a disease or disorder, blue fingernails we're talking about, for it to be expressed, for someone to show the blue fingernails, they have to be little a, little a. So we're going to put a Punnett square up, and it's going to show you what I am, what my partner would be, and how we could make a child that's little a, little a. In fact, why don't we use F? Because F, like for fingernails, right? That's easier to see on the Punnett square. So we're going to look at the Punnett square, and at the top part is going to be me, meaning I am carrying this trait for having blue fingernails, but I don't have them. So I'm going to be a big F and then a little f, meaning I carry it, but I'm not expressing it because I don't have two little f's that I have in my genetic system, okay? My partner is going to be just like me. They're going to be big F, little f. They carry that trait for having blue fingernails. However, they don't express the trait either. It's kind of like if you're doing bingo and you're looking at the letters and the numbers, right? So I'm going to look now. I guess that's an example for it because I feel like it's letter and number and then you meet in the middle. Maybe that's not true. I think that's how bingo works. Let it B-I-N-G-O and then the numbers on the side. Maybe just the numbers underneath. Tomato, tomato. But whatever's on the top and whatever's on the bottom, you're just writing it into the square that corresponds. Okay, so if you do that, you can see that 2 out of the 4 options in this square, 2 of them end up being like me and the partner. Big F, little f, right? So that means 2 out of 4. So these are the 4 options of the offspring that we can have. 2 out of the 4 are big F, little f, meaning 2 out of the 4 carry this genetic trait for having blue fingernails, but they will not have blue fingernails. Then you see that one of them has big F, big F. That offspring does not carry the trait that me and the partner carry, right? So that offspring does not have a chance of being a carrier for it, so they're not going to pass it on to any offspring. They also will not express it, so they won't show blue fingernails because they don't even carry the trait for it, okay? So they're unaffected or not a carrier at all. Then we see that last box there that is little f, okay? That individual there is affected, meaning that individual will have blue fingernails, okay? Because little f, right? They happen to get the little f from me, the little f from my partner. Therefore, they have little f, meaning they will express the things that me and the partner just are carrying as a trait, okay? That is autosomal recessive disorders explained in the way of fingernail color. It's best I can do it. There's so much more to that expressivity and tons of little genetic things that we are not going to go into about how maybe their blue fingernails will be light blue or a darker blue or something like that. Not getting into that. But all intents and purposes, when you see that little 4 square thing, which we call a Punnett square, you can see that 2 out of 4 will be carriers like the mom and dad. Okay, so that's 50%. 1 out of 4 will be big F, big F. They're not a carrier. They don't show blue fingernails. Nothing to be concerned about. However, 1 out of 4, so 25% will be affected. And right now we're talking about blue fingernails. Now this steps me into the next big question on expanding your knowledge. Why is this important? Why do we care about the fact that if I carry something and I have offspring with someone that also carries something, that they could be affected? Why do we care? Because some of those autosomal recessive disorders can be lethal. Some of those autosomal recessive disorders can be life-limiting. The 2 main autosomal recessive disorders that everyone should be offered screening for are cystic fibrosis and spinal muscular atrophy. Okay? Cystic fibrosis is one of those conditions that is what we call life-limiting. Currently, right now, the lifespan of someone with cystic fibrosis is approximately 42 years of age. They can have issues with their lungs, issues with their pancreas, issues with digestion. Males can also have issues with reproducing. Their sperm might not be as mobile. Then we come up to our next question, which is, how is carrier screening performed? It's a blood test. It is a blood draw just from your arm that they send it off to a lab and you'll get results. Now, the individual in a partnership here, really just one person needs to have the screening done. Because if this one person does not carry any of these mutations of concern, then the other partner doesn't need to be tested. That's kind of the important part. So what is it? It's a blood test. You'll get results for the first person who's tested that says, you're not a carrier for anything. There are no autosomal recessive disorders that you carry a mutation for. Or the result will say you are a carrier for certain mutations. And if that's the case, then your partner needs to be screened. Now, the key thing with this that I want to point out is you need to be offered carrier screening. Always, always, always. It is great to be offered it before you become pregnant if you know when you're starting to plan a family. If that hasn't happened or that didn't go in the order in which you had planned, because it's not always planning, right? So if you are pregnant and it's in the first trimester, that's a good time to talk to your provider about carrier screening. At minimum, cystic fibrosis, spinal muscular atrophy. All right, let's go into developing some skills. Now, we know what carrier screening is. The question to talk to your provider about, which I alluded to before, is when can I get carrier screening performed? Now, if you are planning on starting a family and have a plan and you're talking to your provider about family planning and all of these things, then see if you can get that carrier screening done before starting a family. And then you know if you yourself have any autosomal recessive disorders that you're a carrier for. Now, I've mentioned the 2 kind of top ones that we want to make sure everyone is screened for. There are, however, populations that need to be screened for more. There are also panels that you can get done. So I've talked about the 2 common ones that need to be addressed. There are panels for 25 of the autosomal recessive disorders that you can check your carrier screening status for. Then there are panels with hundreds of different mutations, and those are meant for people who have a substantially higher risk at being a carrier for an autosomal recessive disorder. One population that's at a substantially higher risk are Ashkenazi Jews. And so make sure that you talk to your provider not only about when you can get screening done, but what type of screening in particular you need to have done, whether it's a couple, whether it's a small panel or a larger panel. So question kind of number 2 on developing your skills is asking your provider then, what testing for carrier screening do I specifically need to do? And again, that goes into, are you of Ashkenazi Jewish descent? Do you have anyone in your family that has a known autosomal recessive disorder? Those are some things to talk to your provider about to decide exactly how many autosomal recessive disorders you will do carrier screening on for yourself. Now, that also, within this portion of asking the provider, there is a disorder that is associated with autism that is autosomal recessive. So if you have anyone in your family, particularly a first-degree relative, so a brother, a sister, a mom, a dad, or a prior child that has autism, is being worked up for autism, even that has that autism spectrum disorder ongoing diagnosis, make sure your provider knows that, because Fragile X is an autosomal recessive disorder that is associated with autism. And if you would like, you can do carrier screening on yourself to look at more information regarding Fragile X syndrome, which may help you for future planning in pregnancies to know the possible risks of offspring having an increased concern for autism or autism spectrum disorder. And finally, I just like to discuss a little bit about the impact here. The big thing is trying to be able to open up the conversation and the terminology that you can learn so that you can have these important discussions with your provider so that ultimately you can have a healthy pregnancy. Now, learning about carrier screening, go back to that story I mentioned about a couple having a child that had no idea that they even had risks of having a child with cystic fibrosis, and the fact that they never were even offered or knew that they could be screened to find out if they happen to be carriers for cystic fibrosis. Just as one example for what autosomal recessive carrier screening can provide for information prior to or during the pregnancy. And importantly, if you've had that carrier screening done, this is not one that you need to do in multiple pregnancies in the future. Your carrier status is not going to change. So if you have it done prior to becoming pregnant at all, that is your genetic information that you can utilize and know that you have that genetic makeup yourself for any future pregnancy. So you don't have to have it drawn in multiple pregnancies, or you don't have to have it drawn in each pregnancy rather. If you do have a positive carrier screen, this is also something that has a huge impact on your pregnancy or a future pregnancy, because then you know to get your partner tested. And if both of you are carriers for the same autosomal recessive condition, you know that there could be then a 25% chance of having a child affected with whatever it is that we're discussing that you were positive for. And that can change management during the pregnancy, and it can help you to make decisions for future planning for your family. All right, just to recap on a couple of items. So number 1, everyone should be offered carrier screening. You can get it done before pregnancy or once you've become pregnant. Thing number 2, when you're talking to your provider about carrier screening, make sure you talk to them in detail about your personal history. So if you have anyone in your family affected by autism, or if you are of Ashkenazi Jewish descent, make sure to speak with them about those 2 items in particular so you can decide exactly how many items you're going to be checking for your carrier screening and if further expanded carrier screening is needed for your individualized situation. And finally, if you do have a positive carrier screening test, make sure that 2 things are going to happen. Number 1, your partner is tested for that same mutation. And number 2, that you get the opportunity to visit with a genetic counselor to discuss in more detail what that condition would entail if a child was affected with it, and also to really explain and dive even deeper into autosomal recessive disorders, because this is the genetics topic. It's very confusing. There's so much information that goes into it, and I've just given you a little bit of the information today. So many other things can affect specific disorders depending on what that disorder was and what the carrier screen test was that was positive for you if that is your situation. So don't forget those items to talk to your provider about them, and make sure that you're able to go through this information and get some of the definitions. Feel comfortable asking about carrier screening. Maybe when you go in for your well woman exam, that's when we kind of see our OBGYN on a regular basis. Or even if it's your family practitioner, nurse midwife, physician's assistant, whomever your person is that you're seeing on an annual basis to check in on you for exams, if you are interested in becoming pregnant, make sure that you bring up to them, hey, I'd like to look at carrier screening so I know that. Also, if you're in your first pregnancy or in your second, third, or fourth pregnancy and you haven't had carrier screening, you can still have it done during the pregnancy. The pregnancy itself won't change the results. So you can have it done at any time during a pregnancy. So do please talk to your provider about carrier screening. And I hope that you've learned a little bit about some of the autosomal recessive disorders. And again, we talked about cystic fibrosis because it's one I think people hear more about, and that maybe you know someone who's had it or someone who was a carrier, and that may have been kind of scary for them. Leave any comments below, and if you have any questions, and also if there are any other topics you'd like to hear about, I would love to break them down for you so that I can explain them as best I can to really help you expand your knowledge, develop skills, and have a positive impact on you and your pregnancy. I'm Dr. Lexi, wishing you a happy and healthy pregnancy. All right, you want to say bye? That's a good shot. He's like a little baby. Are you like a little baby?